I would like to welcome everyone, honorable ministers of health, education, information, and science and technology. And of course, I would like also to welcome Dr. Ahmed Hamdi, the Director of Science and Technology Department of African Union. So he can already will moderate this session. Just let me introduce myself. I am Dr.Rasha Kelej, the CEO of Merck Foundation. And it's of course today I'm just joining to welcome all of you and to give you a small brief about the objective of this initiative and this program, which is Merck Foundation African Research Summit. We used to have this panel on an annual basis to discuss different objectives. One of them is to build research capacity in African scientific health research community with special focus on women health, cancer, infectious diseases, and vaccine development, which is of course very relevant to the time of coronavirus pandemic we are living in and the global challenge. And also showcase innovative research taking place in projects, programs, and initiatives across African universities and institutions and the wider African research community. Also discuss challenges, opportunities, and propose solutions and strategies to support health decision making in low and middle income countries. Empowering African young researchers and women researchers in advance their research capacity, building their capacity, promote their contribution to STEM.
So, Excellencies, in your point of view, what is the reason behind that? Before you go to the supermarkets, you go to the gathering areas, everybody is putting masks now, they are not observing that. No, they shouldn't be gathering together, they are gathering together, they are celebrating more. So how we can regain the trust and the support of the public on the non-pharmaceutical intervention?
No, I don't know what leadership brought on your table. For that we all have some.
And furthermore, how we are able to ensure that we put in measures that are able to be implemented. So, Excellencies, this is really the starting point for our discussion, and I hope the floor is open, and I believe I may go out from this part of the discussion with a good recommendation that we can take home with us.
This is a very important meeting that we need to be coordinating, we need to be discussing and see the way forward, how we are to bail out our countries and Africa at large. The challenges for girls and women are so paramount, and also the importance of economic empowerment and also the girl education is also so paramount. We are calling upon and even saluting all our partners who are supporting us and make sure that we move together. And as we are looking forward for the African Union and also the United Nations, as well as also our own vision and also our policies as a government. We thank our first ladies and we thank our leadership for guiding us and also for supporting us. They have the passion of the women and girls at heart, and we are looking forward for the issues to move forward as we look into their long live as well as their programs to be implemented. We thank you very much, the leadership of this forum, so that we need to work together and we'll continuously supporting you. Thanks so much and God bless you.
Just to say that we are extremely happy to be associated with this conference call, knowing that as ministry responsible for ICTs and communication, this is critical, especially at this time of the pandemic when Africa is looking at a number of options to ensure that the right processes are done for people not only to get the right information, but also to have efficiency in the way we are, dealing with the COVID. on our side, what we are doing right now with the various agencies of the government here in the Gambia is to roll out the digital initiative that will connect all the government services on one portal to ensure that civil servants across the broad spectrum of the government are able to provide the necessary services, but also get connected to deliver the work efficiently and on time.
Distinguished ladies and gentlemen, globally, most of the population constitutes women and youth. Today, most of these women and youth do not have sustainable income opportunities. There is need, therefore, to hasten efforts in job creation and empowerment for women and youth. I want to mention here that the government of Zambia has developed the Economic Recovery Program 2020 to 2023 that identifies agriculture and manufacturing as some of the key areas for job creation and poverty reduction.
In Zambia, our aspiration is attainment of universal health coverage using a primary healthcare approach. And therefore, even as we respond to COVID-19 pandemic, our focus is on creating resilience in our healthcare system to protect our people from other public health concerns, infectious diseases like HIV/AIDS, malaria, TB, non-communicable diseases, and of course, reproductive health, maternal, neonatal, child, adolescent health, and nutritional issues. Furthermore, in acknowledging that sustainable economic development requires a healthy and productive human capital base, government has set an agenda to promote public health security to ensure that our people and the socio-economic development of our country is progressively insulated from various public health threats.
Cette culture numérique qui manque pour beaucoup de jeunes filles est un handicap pour pouvoir rentabiliser ou pouvoir exploiter ces infrastructures qui sont existantes. Je dirais que la période de pandémie du Covid a montré la puissance du numérique dans l'usage de la puissance du numérique dans tous les aspects ou dans tous les domaines de la vie de tout le pays.
The pandemic has affected health service delivery, most especially maternal health service care delivery. Antenatal care was affected because during this pandemic, the first antenatal care for us, mothers have been going, it went up to 95%, but the fourth antenatal care has significantly reduced due to challenges of transport, challenges the mothers meet along the way. The health service also during COVID has been significantly affected, most especially people with chronic infection, those with TB, HIV, diabetics, hypertension, and other chronic liver disease, cancer, and what have you. And important to say is that domestic violence has significantly gone up, and the economic impact has really negatively affected most especially women. What is the way forward as a team, as member states, as we have come together for this very important meeting? One of the way forward, as we discussed today, is to look at regional collaboration and coordination. How do we collaborate as a region and coordinate some of what we do together? Number two, we need to share best practices, how best the pandemic has been managed in some parts of the country, and what are the negative effects that we can share together, bring on board, and we can take leads from one another.
I have one good news, which links with the Merck Foundation stimulated research innovations on specific areas of interest for Africa. These include drug discovery, real-time testing and sensors, nanoparticle for nucleic acid delivery, and digital innovation in bioelectronics. I would like to agree with the Honorable Minister of Health there from Zambia that Africa does have the capacity, research capacity, which we could, and in fact, we'll be applying, I think, for the calls made by the Merck Foundation. And this will have a platform already created and led by the African standards to provide a window of acceptance for standard medical devices and standards, therapeutic targets to be developed, in vivo, in vitro, and in situ processes to be worked on.
So we have put structures all the way to the ward level to make sure all our people are aware of the protocols which have been put together by the World Health Organization and also our government. Our president, as soon as COVID-19 was declared, our president declared it a national disaster, and he didn't spend time in putting together an interministerial task force, where I'm now the spokesperson as the minister who is in charge of making sure that we educate our people, inform them. I'm also happy to say we have done well in that line. All our people now are aware of those protocols. And again, we still have problems. People are not adhering to all the protocols. It also comes as no surprise that women stand at the front lines of the COVID-19 risks, the crisis. You know, women are healthcare workers, caregivers, innovators, community organizers. So we are doing a lot of work to make sure that our women are aware of all the preventative and precautionary measures.
So we are thankful for that kind of leadership. Now, coming to the question, I'm a Minister of Health, but I'm also a pharmacist by profession. In the ministry, first and foremost, under the COVID-19 pandemic, amid the crisis, as a ministry, we had to make sure that we still provided services to the other health sectors. What I'm saying is all of us were concentrated on COVID, but we had to make sure that there were also other sectors we had provided for our people, those who have other ailments, who have other underlying conditions, like we have programs, HIV and AIDS. We still are fighting malaria. We still had to provide, family planning services to our people. So it was our objective that those other projects, programs, they should continue being provided for our people.
I want to respond to this question, but also to respond to the former issue about the cost of pharmaceuticals. In Zimbabwe, as my colleague, Honorable Minister of Information, Minister Mtwanga, has said, the president has set a very strong and aggressive team against COVID-19. And I'm very glad that it's led mainly by women, the Minister of Defense, and also there's a director who is a woman that coordinates the pandemic. The vaccine in Zimbabwe is free. And our president has taken an aggressive stance. I want to agree with Dr.Rasha that we have to be multifaceted. It's not only the vaccine, but also let's continue to prevent. Let's continue to abide by the WHO rules.
So in Africa, we need to acknowledge the fact that it's going to be an uphill mountain. And we just have to continue working hard as governments, and we just have to continue learning from each other on how best different countries are actually dealing with the misinformation and disinformation.
So Rasha, I'm sure you've seen the gray hair is increasing by the day, but that's because of COVID-19. Really, it is a big challenge dealing with the pandemic and the stages. African countries have done quite a lot, remarkably well. A lot of times people also say it's the demography in Africa, and they also say probably the information, the data is not coming out well. That is why sometimes the numbers are low here and there. Well, I tend to disagree with that a lot of times, because if we have public health strategies that are advised for us to contain the disease, and most of the countries actually followed those, closure of the borders, emphasizing on social distancing, wearing of the mask is a challenge, but we all did quite a lot of what was advised, the quarantining of people, treatment of people who are symptomatic, and isolation of contacts and so on, and active contact tracing. So I think we learned quite a bit from those who had the disease earlier. and then we are able to put in strategies. So we are in Africa with the pandemic where it is. Nonetheless, of course, we should not be complacent because the problem is still here, and we pray we don't have waves that we cannot contain.
Alors, en tant que membre du comité interministériel de riposte, le ministère de l'Information et de la Communication a dû déployer une stratégie extrêmement innovante pour communiquer à la fois, comme je le disais, à l'endroit des populations cibles dans les centres urbains, mais aussi concevoir des messages à l'attention des populations rurales. Et cela s'est fait essentiellement à travers les médias de service public, dont c'est la première mission, mais aussi à travers les radios et télévisions privées que le gouvernement n'a pas manqué de réquisitionner, conformément à la législation guinéenne qui permet de réquisitionner les médias privés en cas d'urgence nationale ou de besoin de communication à large échelle, comme c'est le cas dans le cadre de la pandémie du Covid-19.
I wish to thank the Merck Foundation for providing this platform and their excellencies, in particular President Edgar Lungu, who opened the meeting yesterday, and together with the Zambian First Lady, Mrs. Esther Lungu. My name is Dora Silia. I'm the Minister of Information and Broadcasting Services in Zambia. I'm also the government spokesperson. We've been a year now since the pandemic in Zambia. We had the first case on the 18th of March in 2020. And I think what we first saw in the country was pure panic and also a very clear divide about this is the disease that affects those people and not us. I personally went into one of the high residential areas and was told openly, Minister, you are the one who's going to bring this disease to us. This is a disease for you people and not us. It's for you people who get on planes. And that's because of the manner in which the disease came into Zambia. It was through a family that had gone on holiday in Europe. So we were very clear from the beginning that we needed to be very concise in terms of our communication strategies so that we could win the hearts of the citizens and convince them that this disease could affect everyone. We had a six-step approach in terms of our communication strategy. Beginning with awareness, beginning with making sure that we provide accurate information, that our communication is honest, that it is timely, and also to ensure that we show people that we, the leaders ourselves, care and that we will take action and respect the citizens.
Merci beaucoup pour la parole accordée. Et je commence à remercier aussi les organisateurs de cet événement. Moi, je vais vous partager l'expérience de l'autonomisation de la femme au Burundi. Au Burundi, les femmes représentent plus de 52% du total de la population. Et la majorité d'entre elles vivent en milieu rural et sont agricultrices. L'autonomisation économique des femmes renvoie à leur accès aux ressources et bénéfices, aux activités génératrices de revenus.
So I'd like to thank you very, very much, and I'm looking forward to communicate with you offline to share all our programs of capacity building, research capacity building, and health capacity building, healthcare capacity building. It is a great honor to be with you today, and I would like at the end to acknowledge Professor Frank Stangenberg-Haverkamp. He is the founder of Merck Foundation and the chairman of the Board of Trustees, chairman of Merck Executive Board, and for his support, continuous support to make this happen. And I'm looking forward to meet you again next year in another platform. But I also give me that chance to tell you about the award we had already announced last year. And there was winners from Africa. And I want to tell you about the winners, which is are from Kenya, Nigeria, Kenya again, and Cameroon and DRC Congo. Uganda, and Zimbabwe. These are the winners which are going to actually be announced on our platforms of the researcher, the best young African researcher and the best women African researcher. We are going to actually announce the call for application for the next one within a few 2 weeks, next 2 weeks. And I would like your encouragement to encourage all your researchers to apply for this award, so they can benefit from the mentorship award we are giving to them and the training we are going to give them to build their research capacity. Thank you again, and I'm really grateful for your participation and this networking, and we will keep in touch, of course. Stay tuned for all our programs. Thank you. Bye. Bye-bye. Bye-bye.